Hello, everyone. I'm Marty Hebert. I'm the head of security at RapidSOS, and we're so glad you can spend part of your day here with us at Ready23. So Ready23 is hosted by RapidSOS, and if you're not familiar, we're an intelligence safety platform, and we securely link life-saving data to monitoring centers, 911, and first responders during emergencies. Here at Ready23, we're aiming to foster a sense of unity and community and shared purpose among all the stakeholders in the emergency response ecosystem. And so it provides us an opportunity to connect, collaborate, and catalyze change in the world of public safety and emergency response. And for our audience members, encourage you guys to actively engage. Please ask questions, and we'll do our best to cover as many as we can in the time that we have over the next 30 minutes. So today in this panel, we are joined here by Tina, and we hope soon to have our second panelist, Jess Smith of Nomo Smart Care, who is experiencing some travel delays. While he remains without access to the platform, Tina and I are going to have the initial discussion, and Jess will join us just as soon as he can. With that, Tina, would you mind introducing yourself and telling us a bit more about why you're here, talking to us on this topic?
Absolutely. Thanks, Marty. Good afternoon, everyone. So excited to be here with you, sharing this space today and having this important conversation about the future of our industry. My name is Tina Bonetta, and I'm the director of Aurora 911. I began my public safety career almost 25 years ago. Prior to Y2K, and spent 20 years with the Colorado State Patrol in metro and rural centers across the state. And in 2019, I made the important transition to the city of Aurora and am now the director of Aurora 911. I've been there for almost 4 years now. It is a large metropolitan area. We are currently the third largest city in the state of Colorado, but because we're not landlocked and there's a lot of growth going on, we anticipate we'll become the largest city in Colorado within about the next 15 years. So really learning about technology and introducing it into our large and rapidly growing city is incredibly important to me personally, but also as we, really prepare our team to be able to serve our community well. Leveraging technology is something I'm incredibly passionate about. As we are evolving and we're becoming interconnected with more sources of data, it's really allowing us to evolve as a career and allowing us to connect and meet people where they are and allow that technology to empower us to help people live their best lives. So it's all just a part of a large, big picture situation for me that I can't believe I'm here to see it. I started with pens and papers and dot matrix printers and totally relying on a phone call and the description of a call, like what the caller provided, to be able to take any action. And now we can intervene and become proactive so much earlier with so much more valuable information. It's truly empowering. So thanks for having me today. I'm excited to talk about this new addition and this evolving technology in allowing people to live out their lives with dignity.
Thanks so much, Tina, and we certainly share in the excitement. And I'll do a brief intro of Nomo, which is the technology platform that is partnered with RapidSOS to bring intelligent data about those aging in place to the 911 and first responder community. And I'll leave Jess to introduce himself when he's able to join us. And that's really the topic of this session: is new technologies that are connecting families to help individuals age gracefully in their homes. And this tech, Nomo in particular, provides insights into daily activities and connected loved ones during emergencies. So we'll talk about how these technologies collect that information and how they help individuals in the emergency response ecosystem. And I'll do a brief overview of what Nomo does. We'll let Jess elaborate when he joins, and then Tina, you and I can discuss how that helps those in the 911 community engage with those individuals and better provide service, like you alluded to already. So Nomo Smart Care, it's a tech solution that is installed into the home of someone who is aging in place, typically an elderly person. And to that end, we now have Jess Smith from Nomo join our panel. Thank you, Jess. Great to see you. Appreciate you navigating travel challenges to join us here. Can you hear us okay? You are on mute.
Please tell me you can hear me.
Yes, you are coming through very well, Jess. Perfect timing. Why don't you do a quick introduction of yourself and Nomo? And in fact, we were just launching into a description of the Nomo technology platform, and I think it's a perfect segue to pass it to you.
Perfect. Well, hi everybody, and thank you, and apologies for my being late. I just landed in Peterborough, and so I'm sitting here in the lobby, and happy to be with you guys. If there's an audience that can deal with uncertainty, this is it. My name is Jess Smith. I'm a Vice President of Development, Business Development for Nomo International. I've got 30 years in healthcare experience. In fact, I started my healthcare career as a paramedic in Oregon and in Colorado. So this topic and this conference and our relationship with RapidSOS is near and dear to my heart. Nomo is a new startup. Our aim is to transform the way healthcare is delivered and information is shared, not just across personal caregivers, but professional caregivers who are caring for patients in the home. We are a software company that uses off-the-shelf powerful devices that get deployed into the home. They pick up on ambient data that's generated through mom's routines, getting in and out of the bedroom, getting in and out of the bath, and the kitchen and the fridge. And we roll that up into a pretty powerful and engaging app that takes hundreds of data points generated in a day and simply gives you as a caregiver the summary you need so you can simply answer the question, how's mom? We are live in the market today on Walmart.com, so I'd be remiss not to mention that. One of the things that I'm working on now is expanding our back-end services. So imagine grocery services, dog walking services, telemedicine services, all coming soon through Nomo as mom moves from a lower state need to a higher state need. And yeah, it was a pleasure to have worked with Marty and the team at Rapid to become our first business side service partner. It was obviously super important to our consumers, and it was identified as the very first service needed. So we've got some interesting things we're doing, and I think some of it's unique and helps us support those field responders with the information they need to help out mom. So how's that, Marty?
That's great, Jess. Really nailed it coming immediately off a plane, which I'd imagine most of the audience can appreciate is not the ideal time to immediately present in front of hundreds of folks. So thank you again. Really appreciate you joining. I'll give you a breath. And Tina, a question for you. Maybe can you share a bit more about how in Aurora you guys are using RapidSOS generally?
You know, we started several years ago, and really the focus initially was caller location. That was the draw. But over time, as the portal has developed and as we are onboarding more partners, we've really been introducing the idea of intelligence, and so information analysis. And now we are engaged with many alerts in terms of like alarm monitoring companies. We're able to receive crash information and telematics, and with the inception of the medical profile, that we're able to glean medical information from callers' devices that help us understand what's happening. And as we were preparing to migrate to the premium portal, because we see the value in having information at our fingertips that really allow us to see the full picture and to make intelligence-led decisions that really streamline and specify the right level, acuity, and the type of resources that an individual or a situation needs in the moment. And so our goal is really to incorporate more and more access to these data-driven resources that allow us to serve people, meeting them where they are, and prescribing the right level of resource to them. And that's very exciting. But for us, we've just slowly have learned that we need to continue expanding, and so we're really we're a work in progress. We're certainly not done by any stretch of the imagination, but Rapid has been such an important partner with us in achieving those goals, and even identifying what it is, the direction that we desire to grow.
That's a fantastic answer. And I love the quote, meet people where they are, because I think it dovetails so nicely into what part of NOMO's mission really is, from my perspective, and the technology that they're deploying. So Jess, maybe it would be valuable to hear a bit more about what the platform does, the specific value points that are created for the mom in the home as well as the caregivers, and paint that picture for us.
Yeah, and again, pleasure to be on. So without cameras, without spying, without constantly streaming or exposing PHI, we're able to pick up on the subtle cues that we believe helps personal caregivers not just answer the question, how's mom, but give them the insights they need to possibly intervene sooner with lower levels of care. And we believe through that effort, and obviously we can't prove that out yet, but through that effort, we hope to reduce issues associated with hospitalizations or rehospitalizations or never events that occur across the healthcare system. We hope to help personal caregivers keep from falling into this trap associated with having to figure out where mom goes if she can't take care of herself. And we believe there's a number of things that we can do in partnership with Rapid and other service partners that we have that will help mom just simply live in place and age gracefully, as you guys have put it. Our assortment is very simple. We have a centralized hub that goes in the most widely used part of the house. It does what we call pose estimation, so it uses a number of different technologies to assess the room, scan it. It identifies mom, can tell the difference between a dog and a human. It can pick up on orientation, but again, I don't take pictures. I don't know if she's done her hair, what kind of lipstick she's done, or if she's even wearing clothes. I just simply have an idea of where she's at in the room and how her activity is trajecting. You can communicate through the hub, which means that whether it's a personal caregiver like myself and my parents, or a Rapid SOS on the phone responder, you can dial right into the hub and have a conversation with whomever's there. Obviously, if mom's not responsive, then we take action. If she is responsive, then we learn more and we can provide care. The system is very easy to set up. My parents live 1,000 miles away from me in rural Wyoming. My father set this up on behalf of my mother and did pretty well. We like to believe that this, for the most part, only takes about 15 to 20 minutes to set up by the time you have a cup of coffee with mom. We have range extenders called satellites. These plug into the walls. They pick up on motion, certain sound acoustics, like a toilet flushing or a dog barking or a smoke alarm going off. So again, we don't stream that sound out to make the assessment. All that's done with our machine learning tools and the classifiers that we have embedded into the unit. So again, we get very fresh information, real time, that we can share with our partners. So those satellites just extend that coverage and allow you to look at other rooms, or to maybe double up with other sensors to have confidence that mom really ate or mom really took a bath. And there's ways, and just think about the routine that your mom or your dad or your grandparents go through and the types of ambient signals they would give off. And we just pick those up and we roll them into a nice summary. The final piece of our set are called tags. These are little adhesive back devices. They have accelerometers in them. They've got a help button on them. They're waterproof. You can put them on med cabinets. You can put them on a fridge. You can put them on external doors. And if you tell the app that you're going to assign one as a wearable for mom, you can put it on a lanyard and wear it around your neck. And that'll give you fall detection. It's not the only way we detect falls. Falls are annoying for a lot of people, including people on this phone. And there's a lot of tools that claim fall detection, but You really don't need a lot to be able to claim you can detect a fall, but it still causes a lot of frustration and a lot of false alarms. So yeah, we use the same type of technology, and we continue to build algorithms so that different types of falls show up in a more accurate way. But what happens when a fall really happens? Nothing. And so one of the best triggers that I have as a caregiver that I've set for my parents, if they get up and they're up and around and they're always triggering a data point somewhere, if they go an hour, 20 minutes, 4 hours, 8 hours without any activity, I'm going to get an alert, and it's going to come through my text, and it's going to come to my phone, and I may even get a phone call, and that puts me in a much more knowledgeable position to be able to answer the question how mom is doing, and to be able to react. Probably the biggest example I give you is, again, my parents live a long ways away. They're very mobile. They get out, they travel. They're fairly stubborn, and they don't like to share a lot of information. But Nomo, just over the past couple of days, showed me there was a decline in my mom's normal activity in the morning. And she is, man, up at the crack of dawn at 5 a.m. every morning getting going. And so 6:30 rolls around, 7:30 rolls around, and not a lot of activity. So gave her a call and had a conversation, and come to find out she's got the sniffles and a low-grade fever. There's no way I would have known that. Probably no way she would have told me that until she had a full-blown fever and needed to be treated. So just as a benefactor to Nomo, and one of the biggest value props, again, you're the one that knows personally what kind of routines your parents or your loved ones go through who are trying to live confidently independent. And there are subtle cues that are around that person that give you an indication of how they're doing. And that's all we want to do. We're not here for data. We're not here to commercialize back end anything more than just continuing to give our consumers peace of mind and the tools and the services they need to just take care of mom.
Now, I think it's interesting. Tina and I were talking right before we began the session about the need for this kind of technology, and the approach that Nomo is taking, I think, is really impressive. And hearing you describe the scenarios, just the data that's coming out of the tools that you guys are deploying, gives me a lot of thoughts about the emergency response aspect. In certain cases, these turn into severe events, and we want to provide help as quickly as possible, right? Tina, maybe you could share some thoughts about how that data would influence you guys, right? In the type of scenario that we're describing here.
It was, as I was listening to Jess explain that, it really is so scalable and adaptable, but it really allows, I love the fact, Jess, that you're living far away from your parents, but you're still actively involved in keeping an eye on them, and you're able to do that through this information. And so sometimes it's as simple as checking in on someone to say, hey, is everything okay? So it seems a little off, right? So you learn that mom has the sniffles, and you can address that at that level. And because not everything is an emergency, so if we can intercept and have dialogue early on, we can prevent the emergency. But then, from that aspect, that empowerment, that if you notice that something really is wrong and you're concerned, that you can escalate it as the caregiver, as the person monitoring the situation. And then we're empowered to deploy resources on site to then follow up and check in. When I think about falls, the idea of algorithms is so powerful, because falls are probably one of the most dangerous things that happen for elderly members in their home. And you don't want to wait hours to come to their aid, but something that's off kilter, that can quickly escalate to us. It empowers us to identify what's happening before, before too much time lapses. I think about the changes in the 911 industry since I started, and when I began, the only way I would know about something like that happening in someone's home would be, I haven't heard from them for a week. Can you send someone to go check on them in the home? Or the neighbor comes by and finds them on the floor, and it's been 2 days, which now is becoming a life-threatening emergency. And that the fact that we can use this intelligent data to alert ourselves to that ahead of that is, it's such a difference from where we started. And so we're just really moving in the right direction. I think that it really empowers us also to prescribe the right resource. So it's not just a fire truck, an ambulance, a police car, that we have alternative response models. I mean, in the city of Aurora, that's what we are modeling and building out are, a bank, a whole plethora of alternative response models for a variety of reasons. And I see that your concept and this service fits perfectly into what we're trying to build out, which is scaling the resource to the need, and doing that in a timely and data-driven way. So, this is really setting the stage for the future. And as someone who's closer to retirement than the beginning of my career, I'm personally excited about the fact that this technology is available, because I want to hold on to my life savings and I want to live at home, and I want to be empowered to do that. And so I feel inspired, looking forward to having a longer life, empowered to live in my home the way I want to live. And I think everyone deserves that. So, congratulations. I think that this is a definite game changer in our sunset years.
Well, thank you. And I too look forward to my kids having a tool that'll keep tabs on me. But you're right. And being somebody that cut my teeth as an intern and then a medic in Aurora, you guys have come a long, long ways. What's not scalable right now is our emergency medical services infrastructure, right? You can't put more paramedics and more nurses out in the field and more ambulances. And so and back in the day, I used to thrive. I'm going to date myself, but I used to thrive. I'd throw on my medic bag and my Life Pack 12. That just dated me. And I just love running into uncertainty. But as I get older and as I think about the way things work and as I think about your team, we can't continue to react like that. So how do we evolve the infrastructure, and how do we work within the means we have with folks like you to just deliver intelligence sooner so the right care can be provided? And sometimes that is, not an ambulance, it's a lift assist, but maybe it's a mental health visit, or maybe it's just somebody stopping by, or maybe it's a reminder back to the personal caregiver that something needs to be done, at the next convenient opportunity. So yeah, thrilled for your feedback and to be working with everybody because it takes a village, right, to improve outcomes and to save lives and to just keep people in their homes. So yeah, I really appreciate that.
No, I think you both have hit on some key themes that maybe we can do one more question, and then there might be some questions coming from the audience as well. As you guys think about the future, which we've hit on a bit, what excites you most about the technology changes we're describing here? Tina, I'll start with you.
Everything. Truly, I think what I am most excited about is the way that these platforms and the sharing of data empowers the 911 industry to really transition from becoming information relayers to information analysts and interventionists. And so when we talk about being the first responders, having access to this data truly does allow us to take action prior to a dispatch. We can analyze what's happening and prescribe response. And I think that's really the key change in the industry that I personally have I always knew this was possible. And I've sort of been waiting my whole career for this moment to evolve. And here we are, and I get to be in the middle of it. So excited about that, excited about the opportunity to really scale response, like I've mentioned before, but scaling response to the need. So it's not black and white. It's not a cookie cutter approach to how we serve people, that we're really meeting people where they are, and we are empowering people to live their best lives. At the end of the day, if our community is thriving, then we've been successful. And I would rather prevent emergencies than respond to emergencies. So the number, as much as we can intervene early and when an issue is small, the fewer times we'll have to engage in life-saving efforts, right? And that reserves those resources for those moments. And so when those are happening now, our response to the life-threatening emergencies is on point, because they're not overwhelmed with other things that we now are able to delegate to other better resources. It's very exciting.
Yes. How about you?
My whole goal here is to not take up all the time, and you're already smiling. 30 years in healthcare, working for some of the largest brands, commercializing new products, and I've had the benefit of touching millions of lives, but it just doesn't seem to be enough. And so to me, leaving a 30-year career in healthcare and moving over to consumer electronics was a jaw dropper. But it's the only way I see getting into a true disruptive mode that's going to change and transform the way healthcare is delivered. Right now, it's archaic. There's too many hands in the pie. There's a very challenged and stifled and complicated supply chain process and payment process. And boy, if we can just get a doc on the phone for 30 minutes for $25 and get through that and get on with care, that would be much better. So certainly at the highest level, I share with Tina, changing the way things are done and changing the status quo. Obviously optimizing the use of the resources that we have around us, making sure that paramedics and all the rigs and everybody that responds and call center folks are, their activities are prioritized, and everything they touch and do brings value and cut a lot of waste out of that. Bringing peace of mind to people in need and making sure all of our loved ones are living securely at home. And shoot, if we can save a couple of lives, which I'm sure we'll do together, that would just be the best. So super excited about the future and really see you guys as a part of that solution.
So we have a question from the chat. Jess, I'll throw this to you. Is Nomo able to use the data that you're collecting to devise proactive, preventative measures that mom and dad can enact?
100%. So, one thing you'll learn about us is our technical team, our CTO comes from the gaming space. I come from medical space, and you put those two together and get some real cool things happen. Our interest and our expertise is in kinematics, understanding the body and its orientation and what it's doing and where it's going. So mobility is the biggest thing that we can detect: movement of things, movement of objects, movement of people, and their orientation. And so we can track mobility, and we believe mobility is medicine. One of the biggest things we deal with right now is hip replacements. It's the most common surgical procedure on the outpatient side now with moms and with dads, and it happens to be one of the worst in terms of outcomes and readmissions. And so, what do you do when mom gets home with the hip? You get her up and you get her walking around. And boy, if she sits and lays idle for too long, you get necrotic tissue build up. You don't get the outcomes you need, and then pretty soon you're in a bad spot going back to the hospital, and the hospital's not going to get paid. So yeah, in our app, what we can do is we can see trends, and as we get to know the situation better, and as we engage the user and mom, we get a better picture of what baseline and what normal is. And as we start to see swings in medication activity or in nutritional activity or general mobility activity, we can curate information and bring forward educational resources or even services that folks might need. So, my mom just got a puppy, and so they're enjoying that, but she's already tripped over it once, and she's broken her glasses and scuffed up her knee. So, just being able to get a dog walker or somebody to just, mow the lawn or to get the snow off the walks, as we're doing in Minnesota right now, unfortunately, I think is things that we can do straight away. And our intelligence that we gather on the front end is what informs the back end. So you don't see this random spray of information. We can take a lot of different data points and kind of triangulate and see, maybe this is where the problem is, so here are some resources, educational or services-wise, that you might want to deploy. It's a great question.
And with that, we're at time, and we'll need to wrap. Jess, Tina, thank you so much for sharing your insights and your time with us today. We're so grateful to have you both as a part of our community and for being a part of Ready23. For the audience, if you have any questions, you want to connect, you can find me on LinkedIn. My email is mabear@rapidsos.com. Please continue to join us for as much as you can for the remainder of the sessions for Ready23. Have a safe rest of your day and week.
Thanks, everyone.
Thank you, everybody. Thank you, Tina.